Okay, well, you guys should all be able to see my slides. So I always like to start our presentation off with this quote. I love this quote. It says, "Education is learning what you didn't even know you didn't know." So thank you to our partners for supporting the Hope Series in 2025. Saint Alphonsus, and then the Department of Health and Welfare. Without them, we just wouldn't be able to do this work, and their teams. So very appreciative of that. And then just some reminders here. Uh, if you have not been able to join us for every call, no problem. We love to have you in every call that you can make. But there are ways to see previous presentations. And so there's a couple different ways to get onto that. One is by just scanning this QR code with your phone, and it will take you directly to the YouTube page of all of our previous recorded videos. And all of our amazing presenters. You can also type in this website. You could even take a picture of that now if you like, and it will take you to a part of the WISE website that shows Hope Healthy Options for Prevention Excellence. If you click on that, that will take you right to the YouTube page as well. And then after today's presentation, that will also be posted. I know that's been hugely beneficial to me. We learned such great information from these presentations, so the ability to go back and listen to it again, I think, is invaluable. And then last and foremost, just as a friendly reminder, the 5th Annual Brain Health Symposium is coming up. Registration is now open, so it's on Saturday, October 18th. And a couple different ways that you can register for that. Once again, you can do a QR code. We are utilizing a different servicer this year. It's through SHAMP, which is through U of I. You'll want to just go scroll down and do community registration. Or if you're not a fan of QR codes, no problem. You can just go directly to this website, and it will take you to that same page. And of course, if you need any help with registering, you can also just directly give me a call, and I'm happy to do that. So I'm going to go ahead and stop sharing. So that way we have the opportunity for our presenter today to go ahead and share her slides. And so I'll let her do that. I'm going to make sure everybody is just logged in and then muted, just so we don't have any interruptions. And perfect. And then from here, just have the pleasure of introducing to you Dr. Kara Kuntz. So she is the medical director of the Saint Alphonsus Memory Center, follow peer that I just really appreciate and love working with. Dr. Kuntz also serves on our Brain Health Symposium committee, and I'm so appreciative of all of her support. So Dr. Kuntz will be talking today about late life modifiable risk factors for dementia, and then specifically looking at social isolation, vision loss, and air pollution. And Dr. Kuntz, I'm going to let you take it from here.
All right, thanks, Mary, and happy to be here with all of you today. We are talking about, as Mary said, the late life modifiable risk factors, and there are 3 as they are listed here. I have no disclosures today. You've seen this graphic as part of our sign up for this HOPE project and throughout the course that we've been enjoying this calendar year. So we've talked about many of these modifiable risk factors for dementia as came out of the Lancet review from 2024. And we are now down here focusing on this blue section, seeing that as we go through each of these, it gives a percentage of reduction of cases that would occur if the risk factor itself were eliminated. So we would see 3% less overall dementia cases if we could eliminate air pollution, 2% if we could eliminate vision loss, and 5% if we could eliminate social isolation. We'll spend the majority of the time today on social isolation, as that's the bigger risk factor and just a more complex topic that I want to make sure we have time to explore as a group today. But first, we'll start with air pollution. Long-term exposure to fine particulate matter, referred to as PM 2.5, and nitrous dioxide, is linked with increased risk of dementia and cognitive decline. What is PM 2.5? Well, that's particulate matter that is smaller than the width of a hair and is known to be able to move into our bloodstream from inhalation. So we get it into our lungs and it can pass down into our tiniest bronchi and then into those semi-permeable membranes of our blood vessels that connect closely with our alveoli in our lungs and get into our bloodstream. And that's how they wreak havoc, these fine particulates, because they're not supposed to be there. And they can cause inflammation, they can cause synaptic damage. It's thought that they might be able to accelerate amyloid plaque formation. So, as of course you can imagine, that these pollutants are much more problematic than just dementia, but as they cause problems to many of our organ systems, certainly they cause problems to our nervous system and our brain health. And then recent epidemiological studies, in particular in the US, UK, and China, do show significant correlation between even low exposures of air pollution and cognition. What do we do about this? Well, I think you can do things on a personal level, a policy level as well. So personally, you can use air purifiers. You can limit outdoor exposure when air pollution is high on days that maybe we have inversions or that there is a lot of wildfire smoke in the air. And then choosing walking paths away from busy roads to reduce exposure to various emissions. I want to go back because I put this in my notes down here. I forgot to comment on in terms of air pollution, where do these sources come from? Obviously, people know vehicle emission, but power plants, unvented gas stoves, fireplaces, fuel burning appliances like water heaters, and tobacco smoke. So all of those are sources of pollutants that we need to be aware of and thoughtful of. So I'll come back to this. Obviously, policy level efforts to support clean air initiatives and more urban green spaces and low emission zones. On the local level, you can participate in Boise's Be Idle Free initiative, where they encourage you, if you're going to be stopped in your vehicle for more than 10 seconds, that you turn your engine off. Just to reduce overall emissions from your own vehicle. And then, of course, riding your bicycle more, using more electric options is a good way to reduce personal emissions on your own. And then our trees, right, are essential to increasing oxygen and helping the overall quality of the air. And so there is a City of Trees challenge. You can go to their website here and join the challenge by planting trees where you can. You can even get a free tree annually through this program here to plant in your yard or wherever else you may have property. Vision loss is the next one to discuss. Studies show that uncorrected vision problems are associated with cognitive decline and increased dementia. And why is that? Well, vision is one of our 5 senses. This is sort of the same spiel I give with hearing loss, also one of our 5 senses. And so you can imagine if you have decreased vision or decreased hearing, you have that much decreased input into your brain and that less exercising of your brain that is occurring. And so atrophy can occur. So less cognitive stimulation. But another big issue is the social withdrawal that occurs when we have vision impairment that causes us to socially withdraw. We miss out on relationships. And those social relationships are key to brain exercise. I have patients ask me all the time, what can I do for brain exercise? Is it good enough if I'm doing Sudoku and those sorts of brain puzzles? And I say, well, gosh, brain puzzles are great, especially if the alternative is watching TV. I would rather you were doing Sudoku. But if the option is Sudoku or getting out of your house and going and engaging in an activity with somebody, I would far prefer to see you do that because you're going to use your brain on a much greater level when we interact with a human and have social interactions. And so that is far better exercise for our brain. And then if you can get the trifecta, we talk about social activity, physical activity, and mental activity. If you can get all 3 of those occurring at once, what would be an example of that? Well, maybe taking the movement for memory class at the YMCA, where you're exercising exercising with people, exercising with an instructor who's teaching you new things where you have to pay attention and learn. That's the trifecta of activation of the brain. So if we have vision impairment that causes social withdrawal, we're missing out on all of that other activity and those opportunities to exercise our brain. And of course, vision impairment can lead to depression and falls. So also what can be done here? Well, regular vision screening, especially over the age of 60. Corrective measures, glasses, lenses, cataract surgery. So making sure you're getting your cataract surgeries done when you meet criteria for that. And then, of course, supporting measures to address equitable access to vision care, especially for our underserved populations. So now I want to move on to social isolation and loneliness. And I'm adding loneliness into this because they're so connected, and we'll talk about how that is. But our previous U.S. Surgeon General, Dr. Vivek Murthy, really talked a lot about the importance of addressing social isolation. He declared loneliness as a public health epidemic, emphasizing its profound impact on both individuals and societal well-being. He highlighted that loneliness is far from just a feeling, but a significant risk factor for health, including it is a risk factor for cardiovascular disease, dementia, stroke, depression, anxiety, and premature death. And here are just some areas of focus during his term as our Surgeon General. He put out this in 2023, this report on how on the epidemic of loneliness and isolation, and identified these key takeaways. Humans are wired for social connection, but we've become more isolated than ever. Social connection significantly improves the health and well-being of all individuals. Social connection is vital to community health and success. And together we can advance social connection, and he talks about a variety of ways to do that. So you hear me say these two words, social isolation and loneliness, but let's talk about how they're different and how they're connected. So social isolation speaks more to something that's quantifiable, right? Number of relationships, number of interactions, perhaps in a day. How socially isolated are you in a day, a week, a month, or a year is quantifiable based on how many interactions you may have. Whereas loneliness is more subjective. It's a feeling. So you can be connected, you can be around people, but may still feel very lonely. It's distressing, and there are many different kinds of loneliness. Bringing loneliness and social isolation together is described as social disconnection. And I think that's really what matters here and what we're getting at, even though we use the term social isolation as the modifiable risk factor for dementia. What we worry about is social disconnection. And that's when you have loneliness and isolation occurring. There are many types of loneliness, and this comes out of the Psychology Today literature. They identify situational loneliness, a feeling of being different. So even though you're maybe in a crowd of individuals, you may feel isolated or lonely because you don't identify or connect with those individuals that may be near you. You don't have a loved one that you have a personal, deep connection with, no sweetheart. People that have lost an animal that they were connected with might experience loneliness. Maybe you have lots of relationships, but you feel that none of those relationships have time for you specifically. Perhaps you're an active caregiver doing lots of caring for others, and you are feeling a loss of others caring for you. Perhaps you don't, perhaps you have lots of relationships, but you don't feel that any of those in your life are trustworthy, and that makes you feel lonely. And then perhaps it's a matter of proximity. There's nobody near you to care, to be in a caring, more intimate relationship. So lots of ways to be lonely. I want to highlight the different ways we can experience loneliness or social isolation or social disconnection in these three cases. So here we have a 78-year-old number one. Her name is Irene, and she lives at home alone. She had a wonderful relationship with her husband. They didn't have a lot of other relationships, but she was very connected to him and did not feel lonely. And when he passed, she experienced tremendous loneliness. Then we have an 84-year-old gentleman, Henry. He lives in a memory unit due to dementia, surrounded by lots of people. He is not socially isolated at baseline. But then there was a pandemic that occurred. And prior to this pandemic, he had his family that visited regularly. He could walk and easily recognize them and got along with his walker just fine. But there were lots of moments of quarantine and isolation that occurred during the pandemic. And throughout that time, we observed that he lost a lot of his mobility, became wheelchair dependent. And when his family was able to start visiting him again, he no longer recognized them. And then we have an 81-year-old Sue who lives at home with her husband. She was very worried about the COVID-19 exposures, and so she stayed home a lot and socially isolated. But she considers herself an introvert and wasn't too bothered by it, and kind of enjoyed the, if you will, excuse, as she would tell me, to be home more and enjoy the peacefulness of her home. So these are three very different experiences. Irene was experiencing loneliness with social disconnection due to the loss of her loved one. She was going out of her home less because she was grieving, and she was incredibly lonely because she had lost her husband. So she was experiencing social isolation, loneliness, and disconnection due to the both. Henry was not initially socially isolated, and he was not experiencing loneliness as his family visited him regularly. But after the pandemic and lots of social isolation because of quarantine, he unfortunately experienced both loss of meaningful, close connections and had to be socially isolated at times. And so he experienced social disconnection. The pandemic was tough. No question, we needed to keep people safe and reduce spread of the virus, but we definitely saw during that pandemic, it highlighted this problem of social disconnection more than we'd ever seen before, not just in emotional well-being, but we saw it in terms of physical function and clearly in these individuals living with dementia with loss of cognition and mobility. And Henry was an example of that. That was really hard. And Sue, I would say, was socially isolated and has yet to kind of re-engage with community, but she's not feeling lonely and therefore doesn't feel disconnected. She reaches out to friends as she wants to. She talks to friends on the phone, but she's more of a homebody now than she was prior to the pandemic, and she's fine with that. And so, this is not an issue for her. So it's kind of three different ways to think about how this affects us. Just going to share some data here. So who's dealing with loneliness and social disconnection? Well, it's thought that greater than a third of adults over 45 report feeling lonely. Approximately a fourth of adults age 65 and older are considered to be socially isolated. So this is a large number of adults that are having feelings of loneliness or experiencing social isolation. Older adults are at increased risk for these issues of loneliness and social isolation because they more often are living alone. Their children have grown and left the home. They have loss of friends and family due to age and illness over time. They have their own chronic illnesses that inhibit their own mobility, vision, and hearing that cause them to withdraw and stay home more. And then individuals, immigrants, LGBTQ populations are also reported to be at higher risk for experiencing loneliness than other groups. So how did we get here? Well, long ago, communities were more interconnected. They relied on each other more. They lived in closer proximity and they worked together, right? They might have had a community garden. There was sharing of goods and trading, and people had to interact in order to trade and share those goods. They lived in communities where homes were smaller and proximity to people was greater. And again, this interdependence for survival. Some people grew the food, other people harvested the food, and there was a sharing and a trade, again, that occurred. But now we've advanced with technology in a way that has really separated us, where we can all be next to each other, as shown here on this college campus with all these kids leaning up against, or young adults rather, leaning up against pillars on their college campus on their phones, none of them interacting, right? We see this all the time out in the world where we interact. We live in apartments where we may be in close proximity to each other, but we don't need to rely on each other to survive. We can have food delivered right to our home using our phone. We can work from home. We could do everything from the confines of our apartment and never have to leave or interact with others on a personal level. And so technology offers us a lot of wonderful conveniences and some great challenges as it pertains to social connection. We've talked about this a bit already, but our health outcomes are affected by social disconnection, and there's significant data as reported with these references listed at the bottom here that depression and anxiety, functional disability, as again we saw in the pandemic with many of our individuals living in memory units, again, not only did they decline emotionally and cognitively, but the real shocker was how many became wheelchair dependent or bedbound, just based on social isolation and disconnection. We see people with social isolation in a disconnection experience more pain, more heart disease, strokes, death, and of course, cognitive decline. Social disconnection increases your risk of death by 26%. It's thought to be as bad for your health as smoking cigarettes. Has a greater impact on your health, so is worse for you than obesity, physical inactivity, and air pollution. And people have a higher likelihood to seek and be prescribed dangerous drugs when they're socially isolated. And I see this in my clinic when patients come to me being prescribed more and more drugs for symptoms that at their core are related to social isolation. Let me give you an example. So a woman comes to me and she is experiencing fatigue, constipation, depressed mood, trouble sleeping at night, and joint pain. And she is prescribed a medication for each of those problems. Pain medication for her joint pain. She's on stool softeners for her constipation. She is on an SSRI and a sleeping pill for her depression and her difficulty sleeping. All these medications together have drug interactions, cause more challenges, increase her risk of decreased cognition and falls, in particular her sleep medication. At the heart of what's going on as we talk, she's lonely and socially isolated, and so isn't ambulating much, isn't getting up to drink as much fluid as she should. She spends a lot of time watching television, and so she's developed constipation because of that joint pain due to her sedentary challenges, and her sleep is disrupted because she's less active during the day. But if we could really get at the heart of what's causing her social isolation and her loneliness, we would be able to unravel a lot of these challenges that all come back to this social isolation and loneliness, and hope and work to get her off a lot of those medications that might not be necessary if she had more connectivity in her life. That's not the case with everybody that has a constellation of symptoms, but there certainly are lots of people that are experiencing that constellation of symptoms as due to the root cause of loneliness. And for many people, when we can identify that, they are actually very happy to be aware that they can unravel that ball of symptoms that rooted in loneliness. And so when we start tackling the problem of loneliness, these individuals that I've worked with, they're very empowered to, find ways to make connection and improve some of these other health challenges that they've been dealing with. So a couple studies here that highlight this issue as well. In 2019, there was a study of 1,691 people, 50 years and older, followed for 3 years. Again, notice that people with social isolation and loneliness had lower cognition function. Here, a longitudinal study looking at hearing impairment, loneliness, and social isolation, as well as cognitive function. This was an even higher powered study of over 8,000 people, again, 50 years of age and older, hearing impairment was positively associated with loneliness and social isolation. Loneliness and social isolation were significantly associated with lower memory scores. And then there have been some studies during the pandemic, again, the impact of COVID-19 infection and enforced prolonged social isolation on neuropsychiatric symptoms in older adults with and without dementia. There are 4 studies including older adults without dementia, and 11 included patients with cognitive impairment due to Alzheimer's disease. All found that different neuropsychiatric symptoms emerged and or worsened in older adults with and without dementia. So how do we identify it in ourselves? These are some important questions you can ask yourself or encourage others to ask themselves. How often do you feel a lack of companionship? How often do you feel left out? How often do you feel isolated from others? I think it's helpful to use words in addition to loneliness because sometimes people don't identify with that word, but they do identify with these questions. So asking in different ways is helpful. Asking yourself, do I need help with social skills? Do I need more social support? Do I need more social interaction? Am I grieving? Do I need help with that? Making sure we talk to our doctors and our families about these issues and seek help, as there are lots of ways to get help. There are global efforts that are occurring in our country, the UK, Sweden, and elsewhere. So you can go to any of these sites to learn more. In the US, we've got the Coalition to End Social Isolation and Loneliness. In the UK, there's the Campaign to End Loneliness. You should even have a minister for loneliness to lead a coordinated response. In Sweden, there's a very cool program that's happening. This Salvo, Ending Loneliness by Living Together, is where they pair younger adult immigrants with older adults. They find that immigrants have experienced social isolation because of cultural barriers, and older adults for some of the reasons we've discussed, like maybe hearing loss, mobility problems, and vision. And when they compare their strength, when they can pair the strengths of the immigrants moving in and the older adults, they're able to support and help each other and really address some of the issues that lead to loneliness and isolation. And so that's been a really beautiful project. And then Norway has community clubs and works really hard to connect people through volunteerism and recreational community clubs. Locally, here are some things that may help individuals here. Obviously, counseling, getting help with grief, or building social skills if you find that you're an introvert or it's intimidating to make the initial steps to interact with and build relationships. Psychology Today is a website that we recommend people go to, as you can filter based on your insurance, what type of counselor you're looking for, your zip code. BetterHelp is another national program that helps provide counseling resources. And there's lots of social interaction options. Obviously, the YMCA we're all really aware of and proud of. The Boise Meridian Senior Centers, Fort Boise Church. There's this wonderful program through BSU called the Osher Life Learning Institute that connects people. And then, of course, the AARP, Area Agency on Aging. And then here is this great website, the Idaho Commission on Aging on Loneliness Reduction, if you want to learn more about local opportunities here. So with that, I will stop there and back out of this and just ask